Hi, everybody. Fariha Chaudhry. I'm actually president of the Open Boston chapter, and it's my pleasure to get to introduce our speakers for today's first gupshup of 2022. So let me start with Uzma Samadani, MD, PhD, FACS, and FAANS. Uzma is a private practice neurosurgeon in Minneapolis, Minnesota, and brain injury research at the University of Minnesota. She moved to Minneapolis in 2015 and was named to Minneapolis St. Paul magazine's top doctors in neurosurgery lists in 2016 through 2019. In 2018, she was on the cover of the Top Doctors edition with the byline, "The Doctor Will Save You Now." In 2018, she was also awarded the Courageous Women in Healthcare Award by the Women's Health Leadership Trust. Minnesota Monthly dubbed her a top doctor in Minnesota in both 2018 and 19. Dr. Samadani is an associate professor in the Department of Bioinformatics and Computational Biology at the University of Minnesota, with a graduate faculty appointment in neuroscience. She is also an attending neurosurgeon at the Minneapolis Veterans Administration Medical Center and founder of the neurodiagnostic startup Oculogica, Inc., which has developed the first baseline free concussion diagnostic cleared for marketing approval by the FDA. She holds multiple patents related to brain injury, its treatment, and its consequences. She's been named one of the most creative people in business by Fast Company magazine. She's on the executive committee of the American Association of Neurological Surgeons / Congress of Neurological Surgeons Joint Section on Neurotrauma and Critical Care, and served as scientific program chair for their meeting in conjunction with the National Neurotrauma Society from 2014. She's also served as the chair of the board of Think First Foundation from 2019 to 2021. She's the past chair of the Minnesota State Traumatic Brain and Spinal Cord Injury Research Program and a past president of Women in Neurosurgery. She serves on the board of the G4 Alliance. She's received more than $6 million in research grants from national and international competitive funding agencies to study diagnostics, risks, outcomes, and treatment for brain injury. She's been funded by United States Veterans Administration, Department of Defense, National Space and Biomedical Research Institute, Abbott Diagnostic Laboratories, American College of Surgeons, American Association of Neurological Surgeons, Thrasher Research Fund, Integra, and Stephen and Alexandra Cohen Foundation, and several other organizations. She's certified by the American Board of Neurological Surgeons and a fellow of the American College of Surgeons and American Association of Neurological Surgeons. Her research on brain injury has been discussed in the New York Times, Le Monde, Le Figaro, Wired, Washington Post, Sports Illustrated, Forbes, and Minneapolis Star Tribune, as well as numerous other media sources. She's been a speaker at TED-Med, the North American Brain Injury Society, National Neurotrauma Society, American Association of Neurological Surgeons meeting, and multiple other conferences. She's published 70 peer-reviewed scientific papers and an additional 30 reviews and chapters, including in the Journal of Neurotrauma, JAMA Neurology, Journal of Neurosurgery, and the New England Journal of Medicine. Dr. Samadani also served as an unaffiliated neurotrauma consultant to the National Football League from 2015 to 18. And now let me also introduce Rosina Samadani. So Rosina is a McKinsey and MIT alum with 24 years of experience in healthcare and technology. Currently the CEO of Oculogica, a medical device company founded by a neurosurgeon and dedicated to developing breakthrough technology to fundamentally transform the diagnostic of concussions and traumatic brain injuries with its non-invasive, fast, patent-protected, and peer-reviewed technology. She's raised over $11 million from accredited investors, angel groups, and venture capital, conducted multiple FDA interactions for disruptive breakthrough diagnostics via the de novo and 510(k) pathways, led the procurement of over $2.5 million, funding via the Department of Defense, NIH, and FDA grants, established successful relationships with major research centers and the Department of Defense, implemented QA systems, authored multiple patents, winner of the 2018 Angel Capital Association Louis Villa-Lobos Award for Innovative Startup, winner of the 2019 Nimble Health Vanguard Award for Entrepreneurship in Healthcare, and 2020 Fast Company Most Creative People in Business. She's been with McKinsey & Company for 7 years, serving in the healthcare practice on efforts ranging from clinical development to product marketing. Also holds a PhD in biomedical engineering from Northwestern University and both a BS and MS in mechanical engineering from MIT. And Ambreen, is it okay if I round out with you?
Sure, please do.
Perfect. So Ambreen Mirza, an early member of Open, is the new president of Open Global. Ambreen's first volunteered with Open's $50,000 business plan competition back in 2001 in Boston. And at the time, Open had its presence only in Boston. Over the past 2 decades, she's moderated many events, created partnerships, and recruited members and volunteers. Most recently, she launched Open's Middle East, North Africa, or MENA chapter. Ambreen holds a Master of International Public Policy degree from the School of Advanced International Studies at Johns Hopkins University and a BA in International Relations and History from Tufts University. She's always been passionate about international affairs and socioeconomic development. After Tufts, Ambreen joined Morgan Stanley, where she acquired her securities licenses and training in the financial services industry, along with client relationship skills that proved valuable to her consulting engagements and volunteer activities. She left Morgan Stanley to consult with entrepreneurs, investment publications, international development firms, and nonprofits. She's advised on business planning and fundraising strategies. Her clients have included J.E. Austin and Associates, who retained Ambreen to work on early stage companies from the information communications and technology sector at the International Business Development Center, an incubator in Cairo. Her work for nonprofits includes writing strategic plans, creating partnership agreements with Fortune 500 companies, and drafting fundraising proposals to USAID and other donors. Ambreen has built relationships and partnerships across multiple ecosystems and has written on a range of topics such as private equity investment in Pakistan for the Economist Intelligence Unit. Having worked in a number of roles within the international development sector, Ambreen has long championed social entrepreneurship as a method to address systemic problems in society. Her projects have spanned the healthcare, education, and financial inclusion sectors across MENA, Southeastern Europe, South and Central Asia, and the Caribbean. Boston Green Fest awarded her with the 2019 Green Initiative Leadership Award for her work supporting national disaster programs from Texas to Haiti all the way to Pakistan. Ambreen loves to mentor and teach. She taught undergraduate, graduate, and executive level courses on entrepreneurship, corporate citizenship, civic engagement, and business ethics, including innovative social enterprises for the Tisch College of Civic Life and the Entrepreneurship Center at Tufts University. Students learned how to write a business plan, an elevator pitch, and develop a fundraising strategy. And while mentoring student entrepreneurs at Tufts, she mentored entrepreneurs at Root Cause, a nonprofit accelerator in Boston. During her term as president of Open Global, Ambreen is excited to further strengthen the Open brand, cultivate relationships, and further expand its membership. Thank you.
Well, thanks so much, Fariha. And Fariha Chaudhry is actually has been my partner in crime in the Boston chapter. She's actually the president of the Open Boston chapter, and up until December, I was the chairperson of Open Boston. So we used to lead the founding chapter of Open Boston together. So I have to say I've really enjoyed working with Fariha over the past year and change. And I also have to, say a huge shout out to Muazzam Chaudhry, who was the past president of Open Global for the past 3 years. And he actually started this series called The Chai and Gupshup. And I think he's also on the call. He's probably here, but he's the one who started these series. And I want to thank everyone here for attending today's first session of the year. And this is really exciting. It's an exciting year for us. It's an exciting year for us as Openites. We are starting with so many new chapters that have been seeded over the pandemic. We've actually grown as a community, while a lot of organizations and a lot of companies have been, kind of reevaluating how they're working and why they're working, or what their purpose are. I think our purpose has actually never been stronger. And I'm extremely excited to be talking to both Dr. Uzma Samdani and Dr. Rosina Samdani, because their work is really both something that is very groundbreaking. It's they're really making a social impact. They're also, as you can tell by Fast Company's coverage of them, and by the investment from the Green Bay Packers, the Midwest football team. They're the All-American girls and the successful immigrant story, and so much more. So I'm really excited to introduce them to the Open Network. So thank you everyone again. And I guess let me start by now talking to the Samdani sisters. And I guess first I should say, I don't know how much experience you have with Open, but we are a community that we started as a small organization in Boston, Massachusetts. We grew first to New York, Washington, D.C., Silicon Valley. Then we had chapters in Toronto, Pakistan, the UK. So we also are in MENA, but who would have thought that we have entrepreneurs that are raised in Wisconsin? It's not a likely place to find, we would think, entrepreneurs. Why don't you take us all the way back to the beginning in terms of how you ended up in Wisconsin?
Well, we ended up in Wisconsin because we started out there. So my parents moved to Wisconsin from Chicago. Rosina and I were both born in London, and they moved when I was only a few months old. I think Rosina was a couple of years older than me. And we ended up in Beaver Dam, Wisconsin. And I went to UW-Madison, so I stayed close to home. Rosina obviously went to MIT, but I was there from the age of basically 0 up until 20.
Yeah, we're born and bred Wisconsinites. There are a bunch of Wisconsinites on the call. I just want to acknowledge the head of our school, our high school, Joe Leonards, is on this call. And I'm only nervous about talking when he's in an audience, not anybody else.
Wow, that's really quite the story. And so growing up in Wisconsin, can you take us back and just tell us a little bit about what it meant to be growing up as sisters in Wisconsin? Did you have a mentor? Did you have did you have a dream? Did you know who you were going to be when you grew up back then, and role models? Tell us about the inspiration.
So I think the obvious role model for us is our parents. Both my mom and my dad are the kinds of people who always think of other people first. My dad has dedicated his entire career to being a physician in the service of others. And I remember when we were little, we went to a local ski place near our house in Wisconsin, and someone had a heart attack and my dad gave him CPR. And I remember thinking, wow, it's amazing what my dad can do. And my dad has always also been very innovative. My mom has been amazingly, amazingly supportive. So when we were kids, she always treated us as if we could do absolutely anything in the world and we could accomplish anything. And so I think that has been what's made the difference for us.
Yeah, my dad is very innovative. He's an early adopter. He's a really fun-loving, interested, curious person. There are actually several people on this call that know my dad. Scott Poznansky knows him. Joe Leonards knows him. Solik knows him. And he's just extremely interested in everything, people, technology. He's an early adopter. He encouraged all of us to do that, including my brother, who sort of, credits him with his innovation streak. And then my mom is just a huge believer in education, especially in education for women and girls, and has always been a huge advocate for that. And so there are 5 kids in our family, 4 girls and a boy. everybody is, was encouraged to be as, to try and do the best they could in whatever they wanted to do. So we always felt like we could do anything.
So that's really heartwarming to hear. And looking at the years in review, the past year in review, 2021 is historic for more than one reason. This is the year that MIT has a Pakistani woman dean. And MIT, I'm sure when you arrived there, it was a very different university. Can you tell us about your experience as an undergrad at MIT and what it was like to be the Pakistani woman, that Pakistani engineering student?
Mm-hmm.
You got your BA, your master's in engineering, and you were among a pioneer.
There were
back
very
then,
few. Yeah, there were very few Pakistanis. We all knew each other. Salik was one of them, and we definitely helped each other out. There were also very few women. So overall, there were about 25% women when I entered MIT. And I think I was the third or fourth American Pakistani, or any Pakistani woman that went to MIT. And in fact, I remember it was such a shock. It was such a culture shock to have that experience, that when Uzma got into MIT, I said to her, "Don't come here. It's a really strange place." And I actually regret that a great deal. I think that having that stamp of MIT on your resume, like, sort of changes everything. It's always with you. But that was my candid advice to her way back then, because it was such a male-oriented place. And then in the graduate school, there were 11% women when I went there. And I guess, part of that has actually helped us as we've progressed, because there's not a lot of VC funding for women. There aren't a lot of female founders. There aren't a lot of female CEOs, especially of med tech companies and, STEM-based companies. We grew up in a very unusual environment in which we thought that we were like everybody else. And then you go out into the world and you realize you're not like everybody else. And you wonder where the others are. And I guess we were raised in a different family, and we went to a high school that was really encouraging of girls and boys to pursue science. We really didn't think that we were that unusual until we were launched out.
Well, we even talk now about how, women are underrepresented in STEM careers today in 2021. And so I think that, I'm sure, over the decades, women were even more underrepresented. And which also, I think, historically, we're kind of always told to also take the more secure path, right? And also you're a seasoned entrepreneur. Oculogica is the first startup you're involved with. And I mean, Uzma, you certainly already had a secure path. I mean, you've been listed as a top neurosurgeon. Why become an entrepreneur? Why leave a stable path? What drives you to take that risk and leave? What would motivate you to be an entrepreneur after being recognized as a top doctor?
So starting Oculogica was actually something that I had absolutely no intention of doing. So I became a neurosurgeon in 2006. I finished my residency. 2007, I finished my fellowship. I got board certified in 2010. And around that time, I started working with brain injured patients. And what we were doing was we were trying to figure out if there was an intervention that we could try that would make them better. But we needed some way to determine if they actually were better. We needed an outcome measure. And that's how I developed eye tracking, was as a necessary means for assessing how a patient is doing. And then what happened is my original hope was, I should just, put this on the internet, make it open access, and anyone can download it and use it. But the problem is that's not feasible, because the way the healthcare system works is that if someone doesn't profit from something, then it's not integrated into the healthcare system. So unfortunately, if you want to develop a technology that can be widely implemented, It has to be something that someone can bill for and something that gets reimbursed. And actually, that's the challenge. I think in retrospect, had I known back then, how difficult this is, I actually did the easy part because I developed the original basis for the technology. And then Rosina did the hard part, which is get it through the FDA, not just once, but she's gotten 4 devices cleared now, get the CPT code. And, Rosina did a ton of work when it came to getting the CPT code. She did her homework. She literally looked up all of the people who were involved. She met with them. She had it planned out like, almost like an attack on a foreign country. She literally had her targets. She knew what she wanted to say to them. She knew exactly how she was going to do this.
And then I had a fantastic lead actress who just it was actually fun. Like going to the AMA and getting that CPT code was actually a phenomenal time. And it ended up playing out like a Shakespearean play because there's so many characters and they have so many egos. And it ended up being a great time. But I will answer Uzma's question. I mean, that question, I think from Uzma's perspective, she can't help it. She has these ideas and she has to do these things. And it's not like she's giving up being a neurosurgeon. She's a full-time neurosurgeon. She is the medical input to the company, but she gets to continue doing neurosurgery and still invent these things. It's phenomenal. She's lucky.
So I have other ideas as well. So I'm telling Rosina that, once we get this going, I still have a lot more I want to do with Oculogica. I want to make basically a digital health exam so that, there's one of the biggest problems in brain injury, and Rosina's heard me talk about this nonstop pretty much, is inequity. So what happens is someone comes into the emergency room, and if they are, say, brown or black or not white, they have twice the odds of dying from brain injury. And part of that is that there are 2 steps where that happens. One is at triage. So those patients are less likely to be recognized as having a brain injury very early. And the second is at prognostication. So they're less likely to be perceived as potentially capable of having a good outcome. And I hope that we can change that. That's the goal of our company, is to change the way brain injury is diagnosed and defined so that it's caught earlier, it's caught equitably, and it's treated very aggressively. And not just for concussion, because concussion is one of the indications, but also for all aspects of brain injury. And essentially what we've developed is a monitor. It's a monitor of cranial nerve function. The cranial nerves are some of they subserve very essential functions in the brain, and not just those nerves, but the pathways that feed into them, and then the nuclei that control them and coordinate them. So the hope is that we can use this not just for brain injury, but also for other technologies potentially.
Yeah. And the idea is that concussion to date has been a very subjective diagnosis, and it needs to move to an objective diagnosis. And we are not going to be the only test, but we will be one of 3 to 5 tests that are conducted. And this test and the others will have nothing to do with age, gender, or race. And they should not. And currently that is happening in concussion and in other diagnostics that are out there. Race has something to do with, how you're diagnosed. That really does not, it does not have a role.
Yeah, basically any volitional task is subject to bias. Sorry, I didn't mean to interrupt you.
Oh, no, that's okay. So no, actually I wanted you to put on Rosina, your management consulting, your strategy hat. You've had this experience as a strategist, and I'm wondering about your path to funding this, to funding Oculogica. You run all these business plan competitions. How is it that you found your way to the Green Bay Packers? Because so many people do benefit. Like with how many there's a huge market for this for your product. So how did you find your way to?
So actually, we grew up,
the football coaches.
We grew up in Wisconsin. We're Packers fans, and so that's actually very interesting because we did not find the Packers through just purely being fans with them. We are funded by Golden Seeds, previous to this last round. And Golden Seeds is the largest angel group in the country, and they invest in women-led, women-founded companies. And they've got an enormous network. And they said to us, have you heard that the Green Bay Packers have a venture fund? And we thought, okay, well, why don't we call on them? And the Packers are a really different NFL team. They're community owned. They're not owned and operated by a billionaire. And they've got a very different attitude, I think, than any NFL team towards concussion. I think that they're the only NFL team that could have funded us or would even have talked with us at that stage, early on. And so we were put in touch with them, or rather notified about their existence by Golden Seeds. I then gave them a call, but I also used another contact of mine that happens to live in Green Bay and was at McKinsey with me. And he also sort of put in a word for me, which is what you need to do in VC. You're not always going to get the conversation right out of the gate. Titletown Tech, right from the beginning, has been phenomenal. And they're a joint fund between the Green Bay Packers and Microsoft. And the Packers are a really special team, and I'm not biased. They're community owned, and they have a very different attitude towards towards football and concussion.
And do you watch football?
Yes.
Are you football fans?
Oh yes, we're devastated about the last game, and it's actually inexplicable, those 2 blocked punts. I have to watch it for my work now, but I love the Packers. I'm a shareholder. I've got my share right here. Actually, I don't know if you can see this. I might have to turn off my background. There we go. The legacy.
Oh, nice.
Yeah.
Very nice. Uzma, you were saying something?
No, I mean, I think it's the relationship between football and brain injury is very, very complex, because football has been very good for brain injury. It has raised incredible awareness of the problem. And because of football, people now know that, hey, if you get a concussion, there can be chronic effects of neurotrauma, there can be really significant consequences, and we need to take this seriously. On the other hand, because of brain injury, football has not had a great reputation. And I think what's happening is that's trickling down into other sports. So parents are pulling their kids out of youth sports just out of the fear that they will be injured. And sometimes, the risk benefit profile at that level is not equivalent to what it is at the NFL level. So for many, many children, the benefits of sports outweigh the risks, and it becomes very tricky. So I think that it's important to, keep all things in moderation. And, maybe it's not necessarily that football is the best thing or the worst thing, but rather that we have to think about it as somewhere in the middle, something that, should be made as safe as possible. And, children should be encouraged to play sports. I always say, whenever I give talks on this, I say, every kid should be an athlete. It's just a matter of finding the right sport for them. And for some children who, may have particular physiology, or they may have asthma and they can't run, or they may have other factors that, predispose them towards certain sports and away from others, football might be the right sport. So I think it's a very complicated question.
So you are basically the strategy, the innovator, the scientist behind the football, behind the football coaches or the victories or on the football field. I mean, there's a partnership between the science and business in making football players succeed. I mean, it's many things at play in football. So I like that. Tell me what it is like. What is it like to work with family in Oculogica and grow this business? You started in the same household, and now all this time you come back and you're full circle working together, and you're growing Oculogica as a small business. How is that?
Well, I think the first thing I would say is, when you work with your sibling, you don't have to hold punches. So, you know, when I disagree with something Rosina says, she'll immediately get a text or a phone call. There's no delay.
And vice versa.
Yeah, we give each other quick feedback. You know, we sometimes
You can
have
get right to the heart of it. You don't have to mess around. So there are a lot of advantages. And, you know, even right before this call, she gave me a quick little thing and I gave her a quick little thing. And, you know, there's no formality whatsoever. And that can save you a lot of time and a lot of
we
heartache.
communicate a lot,
Yeah.
sometimes 10 or 20 times a day. You know,
Yeah.
it's important to
Yeah.
communicate.
And it's actually interesting because I think some investors think that, oh, if they tell Uzma something that, you know, she'll be able to convince Rosina and vice versa, you know, what they don't realize is we're absolutely on the same page. We've got the same goals. We are always looking out for each other. And so you can tell me anything about Uzma and I'm going to be on the right side of things with it, with respect to that. And, you know, I know people like investors have complained to Rosina's not moving fast enough and she's not spending enough time on sales or marketing or whatever it is. And, you know, Uzma will come and tell me exactly what the person said. And, you know, she'll get my point of view on that. So it's very, it makes things easy.
That's good.
If you've got a good relationship, you know, it can make things really easy.
What learnings do you bring in to Oculogica from your previous jobs and from your previous experiences?
Well, I think in neurosurgery, you learn to be very, very tough. You know, it's the kind of work where, you know, you can't give up. You have to be extremely resilient. You have to prepare and be very careful. And so, you know, it's the same with.
It's
with
the same,
learning.
yeah. So as a woman at McKinsey, I was, you know, I came in and there were 50% men, 50% women. And after 7 years, I was the last woman in my class. And there were 7 men and myself, and then I left. And that was back when McKinsey wasn't quite so PC and didn't really care about keeping women. And now they seem to have changed, which is fantastic. I hope that it goes more than skin deep. And being a woman in business is really tough. You have to be 3 times better than your male counterpart. That's just a fact. And I used to think, oh, that's not true, or, you know, I'm just imagining it, but we're not. We know, you know, we know exactly what it's taken to get here, how much work it took to get our Series A. The great thing about the FDA is that they don't care who we are or what we look like. It all has to do with the data and the analysis and backing that up. So that's actually very refreshing. And, you know, we've proven ourselves there. We've got the most FDA clearances of any concussion diagnostic in the world, and by a lot. And so, you know, we must be doing something right. The funding part and the, you know, basically doing anything in business, it's really tough as a woman, and you just have to be prepared for that.
I'm very lucky to have Rosina as my partner with this because she does her homework. She's always the one to be prepared for the meeting, to know exactly what the other person had, you know, how they've made their last 10 decisions. She looks that up and she finds out, and she doesn't go into a meeting without knowing exactly what she's going to say and what she expects the other person to say. So I'm very, very fortunate because, you know, I'm not, when it comes to doing business type stuff, I don't have time to have that level of preparation. And so she does the business part, and that really helps.
See, the good thing about what I do is that everything I do is not brain surgery. And so I actually tell everybody in my company, you know, whatever it is that you're working on, it's not brain surgery. You know, I have another mantra, and it's funny that Joe is on this call because I have another mantra that I often tell people, and I say things like, all I need is a really smart high school student to get this done, because smart high school students have a lot of common sense. They don't have a lot of fear, and they're, you know, they're just open. And the things that we're doing are they're difficult because they require preparation, but they're not that difficult from a mental standpoint. We are not doing brain surgery in business. We are doing business. And that means being prepared and understanding the rules. And that's it.
So it's interesting how you say, how it's still so hard to be a woman in the process that you're raising the funds and just being in business. What has changed in in the last 20 years? We're talking about, all you hear in the news is about the Me Too movement, right? Like I said, there's a new dean at MIT who's a Pakistani woman. We have the Pakistan you immigrated from, or might have been born in, or your parents came from. Is it different? I mean, there's a Supreme Court justice who's a Pakistani woman. What would you say is different for women, for immigrants? Has anything changed from your parents from the time when your father was an immigrant?
Definitely.
When he was an innovator.
Yeah, definitely things have changed. I think that we would really love to see them be much further along, and we're shocked and dismayed that they're not. And in some ways, sometimes we feel like we're going backwards. It's actually ridiculous that in 2021, women have received 2.1% of VC funding. That's actually bad business. We should be funding female founders and CEOs because they work so darn hard and they're good investments. And you invest in our company, you're probably going to make money. And it's actually also self-fulfilling. So if you fund a company, they have a higher chance of succeeding. And so, that's why some of the female founded companies and led companies are not succeeding, because they're not getting the funding. If you fund them, they actually would. Betting on women is it's a smart strategy from a return on investment perspective. We're not moving as quickly as I thought we would have 20 years ago. I thought we would have been in a completely different place. That doesn't mean, we give up. That doesn't mean we haven't made progress, but it's a shock. I'm shocked that we're still here.
I would say that one of the things that Rosina and I always joke about is sometimes one of us will get invited to speak at some meeting. Usually it's me, and it'll, like, often at football meetings or something. And I'll say, I'm the only speaker. So my suspicion is that they're inviting me specifically because I'm a woman, or I'm the only female speaker. So I always feel like, that the reason that they're inviting me is that I'm female. And I said, Rosina, do you want to take turns being the token female speaker? And, it happens. But on the other hand, at least we're on stage and they have no choice but to listen to us once we're up there. And, we've been to meetings where we sometimes, I'll say things that other people in the room need to hear. And I think that's good. I think that to get your foot in the door is a good start. So I don't necessarily think it's bad that it's always performative token diversity. At least they're making that much of an effort.
Yeah, at least that has changed, right? Like now McKinsey, it's got the same people in charge. And at least they're now saying that they care, and that it's a little bit more difficult to get rid of all of the women because it doesn't look that great. At least we've made that little tiny bit of progress. But, there's just so much more. And, it's a little tiring to have to continue to prove yourself just to be in the room. But, we're just used to it at this point.
Yeah. Well, tell me about what you're doing. Are you mentors? What are some solutions? Because we at Open, we want to talk about solutions. We're going to do what we can to change things. Mm-hmm. And so we want to hear from you in terms of what can we do?
I think the key thing is don't give up. No matter what obstacles get thrown in your path, you just want to keep going. I have a research lab that I run at the University of Minnesota. I have 4 graduate students, 3 of them are female. And, I try to be a good role model and mentor to them. I've had in my career probably about 60 or 70 students at different levels, from high school, college, med school, residency, postdocs, who've rotated in my lab or worked with me in a research capacity. And I try to continue to mentor them throughout. And I've actually had people who've come to me as high school students and worked with me for 10 years. And it's a very rewarding experience then to see these people go on to build their own careers. I think it's very helpful to them because when they see that someone like me is still alive in academia, it gives them hope for themselves. When I came through the system, there weren't any, when I was at Penn, there was one female attending neurosurgeon, Christina Duhaime, and she left my PGY2 year. And then all of the other women in the department, including Caitlin Carrico, who was, obviously one of the inventors of modified mRNA that's used for the vaccines, all those people left. It's interesting now because everyone's successful, but a lot of people had to move. So I think it's tough. It's tough to see what we've been through, and it's good to see a little bit of progress. And, I do the best to be a good role model to the people behind me.
Just showing up and existing is actually teaching people. So the fact that I knock on the doors of VCs and I don't look like anybody in the company, that helps them. They're like, oh, okay, there is somebody out there that looks like this, is this gender, is this race, and is in a hardcore science field and has got a technology that's actually clinically validated and has got published papers. Just showing up, even if they don't fund you, is educating them. So just existing, in some sort of strange fashion is educating them. We both try to do as much as we possibly can. It's a big responsibility because you do want to attend every event. You want to speak at every event that you're invited to. We're invited to another thing down in Dallas to speak with on a panel for med legal technology and the legal system. And it just gets to be a lot. And so now Uzma is going to take that one. I'm going to take another one, because you don't want to not show up because they're not going to be able to find another woman of color to be on the panel. But there needs to be more of us. There absolutely needs to be more of us. I'm a judge for the StartX. I volunteered to be a judge for StartX, which is the Stanford accelerator that we were a part of, Stanford University accelerator that Uzma and I were a part of. And then I volunteered to be a part of the MIT 100K entrepreneurship program. Part of the reason for that is that I want to see more women applicants, and I want them to see me. I want them to see a woman of color on the judging panel. I think that's really important.
Oftentimes, though, I have to say that sometimes people don't know, they actually just don't know how to support women. So I will have a lot of men say, hey, listen, I want you to help my daughter. I want you to help my wife, or so-and-so and so-and-so. And maybe they just don't know how. And so tell me about, I don't know if you have a son or a brother, but what is your advice for the men in your life who want to, who kind of, want to be better? Sometimes we want to help women, but what about helping men help women, or, helping, also, I think that, sometimes it's a little bit out of really not even intentional, it's sometimes just we need to mentor women, and we need to mentor men, and we kind of all need to help one another too, be creating the world that we want to have for ourselves, basically.
So my dad has been beaten into submission a little bit. He has a t-shirt that says, and Scott is nodding because he knows my dad and he knows he's got 4 very strong daughters. He has a t-shirt that says, when better men are made, Smith women will make them, because one of our sisters went to Smith College. And it's true. The women basically just have to, kind of sometimes beat these guys into submission a little bit. It's not that they're unkind, it's that they're unaware. They absolutely just don't realize.
Well, my son is 20 and he is well versed in how not to be racist or sexist, and that the world is not always just. So whenever he, he would come home from a game and he would say the referees were on the other team, And I would say to him, well, that's just like how it is in real life. The referees are on
Or
the
on the other team.
and you have to be prepared to survive in an unjust system, because that's the way it is in life. And that's how he was raised, so it's good for him.
Yeah.
That's great. Would you describe yourselves as being competitive
With each other?
in life, right? In order to,
Oh, in
what
life,
you want.
absolutely. We're both competitors. We love to compete. We want to be the best. And it's not for ourselves, it's for brain injured patients. Brain injured patients deserve so much better than what they're getting right now, right? They're getting follow my finger, and they're getting a bunch of subjective tests, and it's your brain. Give me a break. They absolutely deserve better. So this is not for us. This is for patients.
I would say I'm competitive when it comes to things like justice and fairness. I've become much more aware of the inequity in the healthcare system in the last 5 or 10 years, and I'm very competitive when it comes to that, because I want to be the person who is a huge pain to my department, because I'm making them aware of problems, and it's not easy. It's definitely not easy. And my thought about Oculogica is, we as a technology are going to succeed, inshallah. It's inevitable, because there has to be a physiologic diagnostic that's going to inform regarding central nervous system function that's useful for a major number of modalities, for all different diseases. Many different conditions affect the central nervous system. So inshallah, we are going to succeed. It's a question of how long it takes and how difficult it is to get there. That's the part that we have Rosina for. So she has to figure that
Yeah.
out.
What is the form of the technology? I mean, this is inevitable. Diagnosing brain injured patients in an objective manner is inevitable. It's just a matter of time,
Yeah. So go ahead.
Oh, sorry. I've got some questions from the audience. So I wanted to actually, sorry to interrupt you. Rose Hasham has a question from Dallas, and she wants to know, what kind of advice would you give your 35-year-old self?
35.
Not that you're not 35 right now, actually. I should make any assumptions.
You mean last year?
I was trying to think of where I was.
25-year-old self, or
Yeah, I mean, the advice I'd give my 35-year-old self is,
what advice would you give your 25-year-old self?
don't sweat the small stuff, That's really it.
Yeah, don't sweat. Yeah, try to step back, see the bigger picture. Tell Uzma to go to MIT. That's what I would have told my 25-year-old self. Although I think I would have had to tell my 20-year-old self, 21-year-old self that.
I think I don't regret anything. I feel like we've been very lucky, and we inshallah are going to succeed. And I have zero regrets about any event that's happened in my life. Every single detail has been, it's been meant to be. And I feel like what we need to focus on, and Rosina knows that this is probably my biggest weakness, is I get upset about stuff, and then I get distracted by that pain or whatever it is. And like, I'll see something that happens at work, and I'll say, this is really unfair. This is inequitable, and there's a huge need to fix this. And then and
it has to do with the patient not getting appropriate care. It usually,
yeah, I mean, I'll see something about the healthcare system that needs changing, and I will get distracted by it. And then I won't focus on, say, writing a paper that could potentially, in the long term, be of more benefit to that patient, fixing things. Like, I just wrote a big paper that I've been working on for a while on inequity in brain injury, and we've submitted it to Lancet. I think it'll probably get rejected, because they're going to say, well, we're not interested in publishing something so radical. But essentially, my thought process is that you just keep trying. And eventually these people are going to read your papers, and they're going to say, okay, maybe she's right. And that's my hope.
I mean, with respect to doing more and doing less of it, I don't know if we could correct to such a degree. We've both been extremely blessed. We're very blessed individuals. We come from a blessed family. All of us on this call are very blessed. We're the lucky ones. We're very grateful for all of those opportunities. Let's just take advantage of them. Getting up in the morning and having a purpose is incredibly important. You want to get educated, and you want your girls to be educated because it's going to fulfill them. And you want them to be happy, content people and not just worried about their external looks and getting married. That can all happen. It is, inshallah, going to happen, but you need to be fulfilled from the inside. And education absolutely does that.
Yep. 100%. I have a question from Asifa in Toronto. She wants to know, she said she's very passionate about using neuroplasticity and the quantum theory to push the boundaries of human potential. And science now says that we can create whatever we want because the brain doesn't know the difference between reality and rehearsing the future. So therefore we can create our future because the brain can be trained for the future. This is actually very relevant to athletes and training. So what is your opinion about?
I think that she's making an excellent point that we don't understand very well when plasticity starts to slow down. We do know that, people myelinate, their brains are myelinating from birth up until probably about late teens. And then by about the age of 35, it's pretty much downhill. There's very little myelination going on. There's much less stem cell regeneration going on, and there's a lot of atrophy. So, what can we do to turn these things around? We know that exercise and, brain tissue oxygenation is important. We know that learning new skills is important. Would understanding how brain injury impacts acutely help us to, sort of control its chronic effects? Yes. And that's what the goal is.
Yeah. Because is there some intervention that we can do acutely that would, basically enhance your chance of recovery?
Yeah.
Thank you. Thank you so much for that answer. And I have another question from Farhan Yunus, who's from Silicon Valley. He's the secretary for the Silicon Valley chapter, and he has a question regarding the algorithm. What did you use as a gold standard for this? And that
is the question. That is the question. Yeah, the clinical reference standard was hotly debated. This is a whole story. Actually, our entire FDA journey is another entire story. There is no gold standard for concussion diagnosis, and so we had to develop that, go discuss that with the FDA. And then actually in the process of our very first FDA submission, unfortunately, the clinical reviewer on our FDA review team died of a heart attack. And so you can only imagine, the discussions that then had to subsequently follow when we had to go talk to a new medical person on the review team. So that is the crux of it. For concussion is that there is no clinical reference standard. And so when you design a clinical study, you're not comparing yourself against anything that's well established. So it's always a debate.
So, thank you.
That's a very simple answer to an extremely complex.
So whenever we talk about sensitivity and specificity of eye tracking for concussion, Rosina and I have this thing where, the FDA, they wanted it, we needed to get through FDA. We had to hire a lawyer. We had to go through the whole process conventionally. And so what we ended up with was concussion, yes, no. And I said to Rosina, this is sort of like fake, because actually what we should be doing is concussion, what kind, right? Is it affecting supratentorial or infratentorial, or, these particular pathways or those particular pathways? And so that is where we're going to go in the future, is sort of classifying the nature of injury so that one can potentially target their therapeutics effectively.
Thank you. That's a really good answer. Res Beaky from Houston has a question about optical nerve recreation.
Hey guys, there's a very vibrant chapter open in Houston. So anything we can do to help you all, we have a very large medical complex, and anything we can do to help you, you can get in touch, and we'd be glad to help.
Okay, so I'm going to take you up on that.
Yes, seriously.
Okay,
seriously.
thank you.
It's
we'd love to-
713-817-3404. 713-817-3404. And
Okay.
it'll be a pleasure to help. I'm working with Dr. Sheila Nierenberg. She's cracked the code that the human cornea, the retina uses to interpret light into binary code. So I have a few other engagements like that where I'm involved in the medtech field as investor advisor. So I'd be glad to help you because I got two granddaughters, Zainab Iman Khan, 6, and Alia Noor Khan, 4. You two are blazing the trails for these girls, and anything I can do to help us, it would be a pleasure. Now, the question I have is glaucoma and eye injuries are affecting people around the world. Sheila is working on a prosthetic retina. But the question I have for you is, how aware are you of any optical nerve regeneration research, whether stem cell based or any other modality? But how aware are you? I would love to find out more about that.
You know what? I will get back to you on email because I want to give you a more nuanced answer than I can give in 30 seconds. Essentially, there is research in this area. As far as I know, it hasn't gotten to the stage of human clinical trials yet, but there's stem cell research and also there's growth factor research. There's a trial being proposed by a group called Cato that we can talk about.
Yeah, I'm in touch with Dr. Larry Benowitz, also from Harvard. So I would love to, and the email is rsiddiqi1@gmail.com. rsiddiqi1@gmail.com.
Okay,
Thank you very much for the time.
Thank you. I'll be in touch.
So we also have a question related to your future plans. So one of our members has asked if you have any plans for an IPO, and I think that you would make a very unique public offering, and you could attract the very best and very high quality investors. So do you have any plans for that?
You know, there are different types of healthcare companies. There's biotech, pharma, medical device. Obviously, we're in the medical device category with a slight twist in that we've got an enormous amount of data. So there's this data component that is actually a little bit of a, it's a bit of a wild card regarding our company. If we're to stick in the med tech world, our market in concussion is $1 billion market. We're expecting $100 to $250 million exit. In my world, that's not IPO material. If we are, going to be heading to $1 billion in revenue, if we were to add on another indication, or if we were to capitalize on our data, which those things could happen, then we're in the land of IPOs. So right now we're in one indication, one country. We're going after just a $1 billion market, and we're going after $100 to $250 million exit. That it's not worth it to go after an IPO for that. In my mind, there are different types of public offerings. You can go, not for the the NASDAQ and some of those. You can go for other places to do an IPO. We could do that. But we've already raised money at higher valuations than I think we would get in some of those, those other IPO formats. So that's just my very quick take. I am not, the CFO. I play the CFO for our company because we don't have one. But I would love to talk with somebody if they've got a different opinion about, how we proceed on that front. If you are preparing for an IPO, you got to start 2 years in advance. So we'd have to start now if we wanted to do it 2 years from now. So those are just my quick thoughts on IPO.
Thank you for that answer. And I have another question from Aisha Hamid, who is our chairperson at Open Lahore. And she asks if there's any help with brain damage due to, maybe this is a good question for you, Uzma, any help with brain damage due to lack of oxygen to the brain at birth, any stem cell therapy In Pakistan, there is a lot of infant brain damage, which is very rampant.
There's nothing that's FDA cleared in the United States for anoxic brain injury. There are clinical trials looking at things like hyperbaric oxygen acutely, but in the chronic phase, it's much, much harder to fix. If there are stem cell trials in this area, I'm not aware of them for this particular indication. I know that there have been stem cell trials for stroke, which is another form of ischemic brain injury. This is definitely something that it's an area where a lot of research is needed, and there's a lot of room for progress to be made. It's not something that's been solved at all. And I'm sorry to hear about, this must be someone you know, so I'm sorry about that.
Thank you, Uzma. This is very wonderful, and very wonderful response. And we have another question from Reshma from Silicon Valley. She asked that if concussion is, and for the brain injury, is the only diagnosis, and if your device is able to detect overall head injuries from sports or eye injuries such as retina detachment.
Retinal detachment, only if it would cause a vision deficit. We would see probably streaking Y vertical lines, but we're not FDA cleared for that indication. What we do know is that when someone has a field cut in a particular area, where we're assessing, that it causes streaking Y vertical lines. We have a patent that covers that aspect of the technology. We don't have FDA clearance, and we don't have, I think the patent is based on 4 patients or 5 patients. That data was collected back in 2012. We don't really have the bandwidth to go after that particular indication right now. As far as sports injury, that's something we're definitely interested in.
I'm very proud of Uzma for that answer.
But the saying that it's not FDA cleared for
We
that.
know that we don't have bandwidth to go after.
Yeah, no, we don't. Retinal detachment, though, is something that I think, when people have it, often they know, because you lose vision very quickly. So, in theory, we're not an acuity test, but in theory, people who have retinal detachment shouldn't need eye tracking to figure that out. They should be able to say, hey, I can't see, I need to go to the ER.
Thank you. That is, thanks for educating us on this. This also leads me to another question about how do you keep innovating? How do you create that path? That has been created
I would say the harder question is
how do we stop innovating?
How do you stop?
Yeah. I have so
that is
many.
not our problem.
I have so many ideas I would love to pursue. I can't possibly pursue all of them.
Yeah. So we've got patents in multiple other indications. There are 3 in particular that we've actually collected data in and want to at least analyze. We've got the data from 4 years in 2 extremely interesting indications, and then another one that we collected over during COVID. And then there's another one that we want to do, which is, I can tell you about it, which is traumatic encephalopathy syndrome, which is the longer term CTE that basically gets all the news. There's so much that we could do. We have to learn we have to focus, and we're actually sitting on data and we don't even know what that data is telling us at this point. So it's not how do we start, it's how do we control, how do we take all of our innovation and figure out what we want to do?
Yeah. And someone just asked, what are our indications? We're aiding the diagnosis of concussion in people aged, is it 4 to 67, Rosina?
5 to 67,
yeah.
7 days of injury from any sport, from any type of injury. There aren't 4 indications that we've got cleared. We've got 4 FDA clearances for different devices for the same indication. Asifa, I think Asifa asked
But we hope to get clearance for other indications in the future, including elevated intracranial pressure, I don't know, Rosina would know the other ones or what, maybe we're not allowed to say anyway.
Yeah, no, we can say, but we've got a lot of work to do before we can get those. And then on the plans for FDA approval in Canada, so Canada, the market is about 1/10 the size of the US market. And in order to sort of achieve our Series B milestones, we're raising a Series B later this year, which is a sort of like a round of funding. We need to show traction. And if we can do that in the US, that would be phenomenal. We don't have the bandwidth to go after Canada right now, given the market size in Canada. We do have some interest there, but we just don't have the capacity to go after it.
Can you talk a little bit about your organizational strategy for Oculogica?
So far we've been
people-wise, some people lessons.
Yeah, so far we've been all engineers and scientists. Monday, we've got 3 sales reps starting actually tomorrow. I'm flying out to Minnesota, going to be staying with Uzma and my parents, and we're going to be doing a week-long training of the sales organization. So we've just started bringing in a commercialization group. We've been extremely science focused, and we've been told that by people on the outside that we don't look like our marketing. Our marketing is not phenomenal. And we're a little proud of that. We like to lead with the science rather than the marketing. We think that that's appropriate for a med tech company. We wouldn't want to be on the other side of things. And so that has been our strategy and our execution to date. I will say from a people perspective, I am looking for people who are smart, people who are passionate, and people who are willing to be extremely candid. Those are the personality traits. I'm actually not so worried about their experience base. I want them to be incredibly intelligent, hopefully smarter than I am, incredibly passionate. I don't know if they can be more passionate than we are, but try and beat us. And then just be completely honest, because we don't have any time for anything else.
Yeah, someone else just put in a question about Australia. We are in Australia, correct?
Yeah, so during COVID, we pivoted away from doing anything in the United States because it really wasn't appropriate in the early days of COVID to call on hospitals. And we said, oh, what country is doing okay? Australia. And then lo and behold, Australia had the toughest lockdown of anybody. So we did actually go ahead and get our TGA, which is the equivalent of the FDA approval in Australia and New Zealand. And we've got a couple of devices over there. We
have a distributor in Australia.
Yes. And I'm happy to answer questions about the Series B. We need to only speak with accredited investors. So, get in touch with me. I don't think I'm allowed to actually fundraise on this call because
no,
we don't.
But,
I've got a message asking from somebody, and so we only raise money from accredited investors.
Yeah, but we'll happy to. You can offline. You can meet and talk to people, and
people are welcome to email me, and we can talk with them.
Sure, certainly. Yeah, we're happy to connect people and offline. So thank you so much. And let me see if there are more questions from the audience, because there are plenty of things to talk about here.
What would you advise a medical school grad going through residency path? Is it worth researching?
So, if I may, hi, Assalamualaikum.
Alaikum salam.
I have 6 kids, and 3 of them are science majors. 2 of my boys are medical school grads, and their wives are medical school grads, and they're going through their, the regular pathway of doing their research along with their examinations to get into residency. I know one of my kids is interested in neuroscience, so my question was, would you advise people in that stage to pursue networking with people like you and pursue a pathway while they're applying for residency in the hopes to, get onto the pathway? Like if somebody wants to be in neuroscience, neurosurgery, and research, would you advise such a pathway? Because I know one of you is in full-time neurosurgeon as well as startup entrepreneur. And thank you for that.
Yeah, I think the bottom line is your kid has to do what they love. And if your kid really is interested in neurosurgery, then, that's what they should do. There's no question that it's a matter of, I didn't find out that I love neurosurgery until I was in med school. But I think that if your child is interested in a particular topic, that's what they should do. And, you shouldn't try and do something just because it's hard. A lot of people make that mistake where, they pick the biggest challenge they can possibly find and then tackle it. And then they want to move on to another challenge. That make sure you don't do it because of that reason, because, it's a common reason. You'd be surprised. You have to do it because you love it. I mean, I actually still love neurosurgery. The other day, Friday, I had a patient who came to my clinic, and it was the patient and his daughter. And she said to me, she said, before you operated on my dad, all he would do is lie on his bed or lie on the couch, and he couldn't move around at all. And now, since you've operated on him, he's always in the garage, he's tinkering, he's doing construction, he's working on things, he's fixing things. And she said, sometimes I don't even know where he is because he goes around so much, and he's running around their farm. And she said, thank you for giving him his life back. And that made my day.
That would make your life. Like,
yeah, I mean,
that would make your
it
life.
just, that's why you do what you do, because that's your opportunity to intervene in someone's life and make it better.
Change it
And-
forever. Change it
and
forever.
That's why you do neurosurgery. It's a lot of work. There's a lot of homework involved, but that's why we do it.
You have got to be extremely excited to get up in the morning and go do what you are going to go do, because it's going to fulfill you. I've already said this in this talk. I get up every single day extremely early because, and our niece just said that about me, because I'm so excited about what I'm working on. And we get calls from patients saying, and actually we've got a couple of quotes up on our websites, and it's mostly, the parents of the patients saying, thank goodness we now know what's going on with our kid, because we didn't know. Those are the best moments. Those are the reasons you do the things that you do.
So I have a question. And I was speaking, and I had a few exchanges with Najib Ghauri, who's also one of our members, and he's an entrepreneur who works with his brother, leading a software company that has now grown to more than 1,700 people. What did your parents do right in terms of the sibling management piece, right? So we talked about.
I think my parents are on. They can.
Yes, they are, right? I was going, yeah, and they're welcome to chime in, because we talked about, you asked me a question. I asked you a question. Are you competitive? And you said with each other, and I think it would be interesting, and your parents can chime in about, how do you raise, you want to be competitive professionally, but you want to maintain your relationships amongst each other and collaborate. So,
I just want to clarify. I don't think we answered that we were competitive with each other, because we both have very different skills and very different areas of expertise. So I am not trying to be a brain surgeon or even play one on TV.
Right.
We are competitive out there in the world. We're we're competitors for sure.
Right.
We want to kill it. Honestly, we just want to kill it, not just with this company, but with the next one and the next one.
Right.
But yeah, we'd have to get I don't know, should we have mom and dad answer?
I don't know if they're still around, because
I don't know if they're still around, and I don't know if they're.
So that's what I wanted to get at, actually, is that how do you stay competitive work-wise, right, and manage inside the home and work together, and so this is what I wanted to ask you this question about, like how you're managing your relationship and how your parents raised you in the family so that this is successful.
Oh, I think my parents have been very good at teaching us to resolve conflicts on our own, even from a very young age. So we didn't have helicopter parents. If we had disagreements, they might separate us, but they never interfered in how we made decisions or resolutions. And so that's played out into our adulthood. And usually whenever we have a conflict, which we do have, we resolve it.
Excellent. Well, thank you so much. And if anyone has more questions for the sisters, if you have some questions for us as for our open community, you please feel free to ask us questions as well. We've really enjoyed speaking with you and learning more about Oculogica and how you've grown your company, and this has really been just fantastic. I think you both have kind of paved the way for like both as innovators, entrepreneurs, and business leaders, and really distinguished yourself as both a neurosurgeon, as an engineer, as a management consultant. So it's really been an honor to speak to you and see how you really managed, or as a woman, as a Pakistani American, as a minority. So thank you so much for joining us today.
Thank you for having us.
Thanks for having us. Thanks for being an organization. I've actually known about the organization for years. I think I spoke at an open event like a decade ago, or maybe longer.
Yes, it was. I remember that very well, actually, in Boston. Yeah. I do remember that. And that's why, I thought it would be, and that's exactly why I wanted you actually to be among the people to kick off the, be one of the, first speakers of the year, because I do remember you speaking at one of our first events in Boston with a women's panel. And so I think at that time we were at McKinsey. So that's why I really thought it would be wonderful to have you back and speak to Openites, because so much has happened over the years between Open and your own journey. So that's exactly was my thinking. So I really appreciate you kind of taking the time and staying invested in the community and sharing your journey. And, and I'm sure all of our members, I can see so much enthusiasm and seeing the buzz both before the event and during the event, and all the questions popping up and getting them on my phone too. So, thanks again. And we're going to record this, share the recording. We'll, do a little bit of editing out some of my beginning, like that, as people are jumping on, and we'll be sharing that with everyone. So thanks again. Thank you very much for your time and your candid conversation.
Thank you. Happy to come back anytime. Happy to help out. Just let us know what we can do.
Yes, we will definitely do that. We'll take you up on that offer.
Okay, and really nice to see some old friends on here that I haven't seen literally, in like many years. So thanks for showing up.